Good evening, everyone. Feel free to keep grabbing food and take your seats whenever you're ready. So I'd like to welcome you all. Thank you so much for participating in our event tonight. We would really like to thank the Rose Service Learning Fellowship for supporting this symposium and all our visiting students for coming over here. My name is Simone Passarelli. I'm a third-year PhD student in the Department of Nutrition, the Population Health Sciences PhD program. And today's session is hosted by the global cohort of doctoral students who are sitting out. Sarah's out here too, and in the front row here, supported by a lot of faculty members who are also in the room with us. And it's a student-led partnership program that facilitates collaborations between public health PhD students at the Harvard Chan School and universities around the world. The goal of tonight's symposium is to hear about and discuss some of the efforts for reciprocal capacity strengthening from both some student and some faculty perspectives. We'll first hear from Wafai Fauzi, and followed by Bethany Gauthier, who will both share their experiences with reciprocal capacity building in a global health context. So then we'll hear a little bit more about what is the global cohort of doctoral students in a short presentation, followed by a student panel moderated by Bethany. And after that, we're going to hear a little bit from you with some audience participation in some small group discussion to think about how you can apply some of these concepts in some of your own global health work. So I'm pleased to announce our first speaker, Dr. Wafai Fauzi, who is my advisor, as well as an advisor to the global cohort of doctoral students in our program. He's a professor in the Department of Global Health and Population, as well as in the Department of Epidemiology and Nutrition. And his work focuses on infectious disease and maternal, child, and adolescent health and nutrition. And he has a lot of experience in building global partnerships and collaborations abroad. So thank you, Wafai, for being here.
Thank you so much. Good evening, everybody, and it's really a pleasure to see so many friends and colleagues and students attending. I would like to thank people who have put a lot of effort in organizing this event today, Harry and Chris, and all members of the global cohort, and friends of the global cohort who are attending here today. So I will reflect a little bit on some of our experiences with research and partnership and capacity building. Maybe starting a little bit with my own training here. Just a few years ago, I was a doctoral student at the school. Finished medical school in Sudan, practiced for 2 years, and then came to the school to do an MPH. And then, fortunately, got admitted to the doctoral program, then did a postdoc, and then joined the faculty, and I've been here for long. It's a wonderful place to be, as all of us experience it every day. So right after my defense, and I finished in epidemiology and nutrition, I traveled to Tanzania. I was hoping to do that as a doctoral project, and then it ended up being a postdoc opportunity for me. And it extended some of my research as a doctoral student. My advisor had a large program in the Sudan. I was mentored by Guillermo Herrera and Walter Willett on vitamin A and child health among a trial of 30,000 kids. And so my study in Tanzania, one of the earlier activities, or the earliest activity, was an extension of that work where we designed a trial on vitamin A and children hospitalized with pneumonia. And I was fortunate to have the funding that allowed me to do that. As I was finishing my doctoral program, I applied for that with support from my mentors. That trial led to a second trial and a third trial, and subsequently, fortunately, a number of activities and projects that allowed us to expand our partnership with colleagues in Tanzania. Building really research on nutrition, maternal child health, infectious diseases, including HIV, TB, and malaria. One of the sort of principles that we have pursued really as a partnership with colleagues in Tanzania, and that has become really a key and foundational element of everything we did, is just a basic principle of equity and collegiality and friendship in everything that we did. So we started with 2 or 3 colleagues and then expanded to collaborate with other faculty at Muhimbili University, and expanded to collaborate with other institutions in Tanzania. In every project we did, I would say right from the beginning, it was an idea that was developed together. The proposal was jointly developed. We sought funding together. We co-implemented activities. We co-analyzed and co-wrote those results. And so that basic principle of equity has been important to us. So that allowed us to develop the research program along the lines that I have mentioned. At the same time, fortunately, after sort of a little bit of time as a postdoc, I was fortunate to join the faculty here. And one of the key responsibilities of faculty is to also train and mentor students at the school, master's students, doctoral students. And so it's important for us to do that. It sort of allows us to develop the next generation of leaders. Many of them are here in this room, to be able to take over as faculty or as leaders in other organizations, be it World Bank or research organizations or other national or international organizations. So that's something that I've been sort of excited to partake in for our own training of students here at the school. But it was sort of apparent right early on that as we are concerned and continue to be concerned about training of our students here, there are really similar and parallel interests of our partner institutions where we work, in Tanzania in this case, and in other countries, to also nurture their own faculty and their own capacity to undertake research. In our earlier engagements, in our first projects, and Chris Duggan has been a partner in many of those projects that we have in Tanzania and elsewhere. We used to have, it was evident that we used to have a master's, a US, most of the time, trained master's level research specialist who would be based in Tanzania to help guide and be part of implementation, really to support the faculty on the ground, the Tanzanian faculty, with us in the implementation of those studies, be it regulatory issues, recruitment, follow-up, data, lab, and so on. And so there weren't enough sort of trained faculty and researchers at the partner institution to be able to carry on their part of the engagement. And unfortunately, over time, this has improved significantly, partly due to our engagement, but partly due to many other people supporting those efforts. And I'd like to say that for the last few years, we do not have people from here who are traveling there to be research specialists. There are Tanzanians on the ground who are leading those efforts. So in order to be able to train the next generation of leaders from Tanzania, in this case, where I've spent most of my collaborative work, it was helpful for us to have the opportunity to tap into training grants that are available for that purpose. So I was fortunate to be able to put together training programs. The NIH has a center known as the Fogarty International Center that allows us to apply for training programs, typically with one particular country at a time. So My partnership was with Tanzania, with a number of faculty here at the school. And over time, we have been successful to apply and secure maybe 8 to 10 training grants over the last couple of decades. Essentially, these are 5-year training programs that allow us to do a number of things. To bring Tanzanians here to do degree programs at the master's level or at the doctoral level, to have junior faculty come for shorter courses in our summer or for short sabbaticals to be able to concentrate and write and analyze and pursue new proposals or learn new skills. And increasingly to be able to carry out training in country itself. So for short courses or mentoring of junior investigators on site. Increasingly, with many of the trainees who have come here, our Tanzanian partners, going back and leading those efforts with Harvard faculty as well. So the training in country would be largely in the form of short courses that could be put together and could be building blocks as part of their curriculum and their own training in perhaps 3 big categories of activities. One, training on methods. So we spent some time training in epidemiology or biostatistics. Bethany, who has been a wonderful collaborator and partner while she was building a massive enterprise in Rwanda. We have benefited from that in Tanzania as well. Or training in a second track around substantive areas of knowledge, be it MCH or HIV or the like. And the third track that we have been keen to develop as part of our efforts is really around the basic sort of nuts and bolts of research management, grants management, manuscript development, grant writing, regulatory issues, things that are essential for any faculty to be able to thrive and to develop their own portfolio of research. The training grants also provided us an opportunity to build the capacity with our partner institutions in other ways, development of space in some cases, development of a lab infrastructure, development of a pharmacy that's necessary for the conduct of clinical trials, randomization, labeling, etc. I've been fortunate to continue to work in Tanzania for many years. About a couple of years ago, we have realized that we have been learning really from a number of institutions at the same time in Tanzania. Our general approach has been really to be open-minded and collaborate with Muhimbili University, with Ifakara Health Institute, with the Ministry of Health and its own investigators. But a key element has been really to have, wherever we went and we started working in Ethiopia or in India or other settings, is really to make it a point to partner with academic institutions rather than exclusively work with NGOs. So people who are our peers, faculty, students who are keen on advancing the academic enterprise within that particular country, but not to the exclusion of Helen Keller International or other more sort of NGO type activities, operations that are clearly essential, especially as we engage more with aspects of implementation science. But as we learned from our experience in Tanzania and bringing together these various institutions, there were other partners at the school who have been also active with other countries. And so these led us to put together a network that we call the Arize Network, which essentially is an acronym for Africa Research, Implementation Science, and Education. The network started with 7 countries that brought together many of these bilateral tracks. Harvard Tanzania, done some work in Uganda with Makerere, South Africa, where a number of colleagues at Mass General have activities with Mbarara Hospital and Mbarara University in Uganda. Colleagues in Ethiopia, several of us are active in Ethiopia, and colleagues in Ghana, Botswana, Nigeria. And more recently, fortunately, I've been fortunate to add Rwanda and Burkina Faso. So we have about 9 countries in the Arize Network that allows us to continue to engage with these partners beyond the bilateral strong links that we have, and we continue to nurture those bilateral links, but really in a multilateral way that is quite beneficial to us as a university, as a school, but also an opportunity for these countries also to network among themselves and to enhance this South-to-South collaboration and pooling of resources as opportunities arise when it comes to training in some aspects. And so within the Arize Network, there are 2 particular tracks. One is on research, on education. The education is a strong partnership with Marcello Pagano and Bethany and other colleagues, really focusing on training in implementation science methods. Our first course happened here at the school. It's really training of trainers. And Mohammed was one of the colleagues who joined us. The second course was in Rwanda with Alicia Larson, who is there, led the training this past January and hosted by Mohammed. And Mohammed has been really one example, among many others, who is both a trainee on the one hand, finishing his PhD on the third and second, and on the third, he's really having his own junior colleagues that he is mentoring and trying to help nurture and develop. So delighted really that we have this opportunity to work with the global cohort. In closing, I would say none of the things that I have done would have been possible without mentoring. I have benefited from mentors myself. I still do. I wouldn't be able to continue to advance without the support I receive from senior colleagues, from junior colleagues, and from my peers. What's unique about the global cohort clearly is beyond sort of peer mentoring, which we hear a lot about, which typically means a more advanced student really helping an incoming student, or more advanced student bringing in, helping with recruitment of students, or showing the ropes to somebody. This is an equitable partnership in the pairs that have been assembled together. And it is sort of groups that are aspiring about the same level to rise together with support of everybody in the community. I think it's already off to a great start. There are 4 wonderful pairs, and there are others I understand are in the pipeline. It has been really a privilege for me to watch this grow and appreciate all the efforts that have gone into it, right from its foundation by Harry and Chris and everybody else who is contributing to it. It's already respected, recognized, appreciated within our school community. I think even beyond the school community, it is being noticed. I was at CUGH a couple of weeks ago, and there was a poster that has won the best poster. And I tried to go and see Harry when he was standing by the poster, but I never managed to, because he was always mobbed by people who are curious to find out what is this global cohort that is taking off. So thank you so much, and I look forward to the rest of the session today.
Thank you, Professor Fry, for the good presentation. It is with a special excitement that I'm pleased to welcome Dr. Bethany to our first annual conference symposium of the Global Cohort. Dr. Bethany is a biostatistician, associate professor of global health and statistics. Our primary research interests include quantifying the health needs and evaluating programs targeting marginalized population with focus on global health research. It's currently the research related to the provision of cesarean section and outcomes in rural district hospital in Rwanda. Our work spans on multiple countries with extended presence in Namibia, Malawi, and Rwanda. which contributes greatly on statistical capacity building made of the researchers and students from different universities around the world. In 2012, Dr. Bethany has led a comprehensive capacity building in Rwanda through Partners in Health and working with the Ministry of Health. So among the people who benefited from his capacity building, me, who is in front of you. I remember the time that Bethany Rwanda was among the few PhD holder in best statistics in the country. So the time I met her was like a great opportunity to learn and to build capacity of Rwandan scientists. So we used that opportunity and we did a great work in our country. Mentored a lot of people, including myself. A lot of work that you are seeing from Rwanda contributed a lot, not only in the capacity building, but also in shaping the health system in Rwanda. As you know, most of the decisions are based on the evidence, and she's contributing on availing evidence and assuring the quality methods that can guide a good implementation of health interventions in Rwanda. So specifically for Rwanda, we benefited a lot as a Rwandan scientist, as Rwandan scholar, and also as Rwandan in our as community and health system. So recently, in the Consortium of Universities for the Global Health, 10th Annual Conference in Chicago, Dr. Bethany was awarded a VRID Global Health Education Award. So please join me to welcome Dr. Bethany.
I've known Mohammed for a long time. That's the most formal. Probably. I'm so excited to be here. These are conversations a long time in the making, and just really thrilled of the energy and commitment and resolve of the students to see this through. Humbled to follow after Wafai, who has just really set the groundwork and set a high bar for all of us to follow. So thank you. For those of you that I don't know, so I also was a student here. I trained in biostatistics and graduated my postdoc here and moved one block down the street to global health and social medicine at Harvard Medical School. I still hold an appointment in biostatistics here. I still work closely with a lot of the faculty that I trained with, and feel really privileged to be able to do the work that I do with the people that I work with, both here in Boston and Rwanda. I'm going to preface this by saying that I'm going to talk from my perspective, and my perspective really is largely from both being trained at an institution in the United States and then currently being faculty here. I do think some of my experiences and observations apply to PhD students no matter where you're training and to faculty no matter where you sit, but there certainly will be a bit of a bias from that perspective. I hope that one of the take-home messages is that collaboration is incredibly important for global health. Certainly, if you look at the work that I do, I could not do it alone. I need the expertise of Mohammed, who's working in the HIV division for the last almost 10 years. His expertise in HIV. I need the expertise of Robert Riviello, who's a surgeon. It really isn't possible to do any of our work in academia without collaborations, and that's certainly true in global health. That's certainly true when you're talking about a context like Rwanda, where it is true that Rwanda has just started its first PhD in data science, and so there is a role for statisticians to play in that country to support the careers and the research of talent like Mohammed. However, what should also be clear is that the way these collaborations are shaped and the way that these collaborations develop have power dynamics associated with them, and that as we practice in these collaborations, that we need to be aware of those power dynamics and how it is impacting the way we collaborate with our colleagues. So just as an example of that, I've been working with a team on a bibliometric analysis of papers that are about health from sub-Saharan Africa between 2014 and 2016. In 2014, PubMed actually started collecting country of affiliation for the co-authors when a paper was indexed in PubMed. So that gives us a bit of information that we can use to try and look at where are authors affiliated. And what we found actually is a promising improvement. If you looked even a decade ago, the engagement of local co-authors would be considerably less than 50%. And so for me, one of the promising results of this bibliometric analysis, I don't know if there's I will be my own pointer. If you look across all co-authors, 50% of co-authors on these papers about health in sub-Saharan Africa were from the country that the research was about. And that also included almost 50% of first authors. And that, for folks who've been working in global health research for a while, I think that is a promising improvement from what we have seen in the past. And I think those numbers will continue to go up as we continue to invest in researchers and research training programs. One of the lenses that we wanted to look at this with was noting that collaborations are important. How does that collaborative dynamic affect the engagement of local co-authors? And so we specifically identified the top 20 U.S. universities practicing in global health. And we looked at any papers that had an author from one of these top 20 universities as a co-author. And that's what you'll see here in orange. As soon as you have a co-author from a top U.S. university, you see engagement overall decrease and most certainly engagement in the prominent positions. And there's a lot of debate about the use of bibliometrics to talk about issues around equity. One point I will make is I think this is an indicator. I think it is a trend for an indicator for how we collaborate, how we include individuals. The other thing I would say with that is for those of us who have been in this for a while, and I'm not as far on this trajectory as other faculty in this room, even that first co-authorship is pivotal to how your whole career is shaped and the pace at which your career is shaped. And so allowing someone or not allowing someone the opportunity to co-author, allowing someone or not allowing someone the opportunity to be a first author, nurturing that experience for them can really shape the trajectory of their career. And so while this may just be an indicator that does or does not measure equity well, it certainly is shaping the course of independence of individual researchers in their careers. I also think that this has issues beyond the impact of a single person's career. It certainly undermines the talent development at institutions and limits the independence of developing the infrastructure and the funding to support University of Rwanda, as an example. If we're not supporting this model of getting more grants into the University of Rwanda, it's going to limit their trajectory. But I also fundamentally believe that it undermines the impact of the science, that if we're not doing good collaborative research, and specifically if the research that we're doing is not driven by individuals who know the problems, who can actually translate the results into implementation, then it's fundamentally worse science. And so, that is also something to keep in mind when we think about equity in this space. So as Mohammed mentioned, when I started on faculty at the medical school, one of the features of my department is we partner closely with Partners in Health. And so we're able to operate at this intersection of implementation and research. I quite enjoy it. Can go in the field, can be based in Boston. I spent the first 3.5 years of my faculty position based in Rwanda, and I spent about 20% of my time there. And I was tasked with two distinct goals when I was invited to move to Rwanda. The first was to increase the research documenting Partners in Health Rwanda's experience. And the idea there was that we did believe we had some best practices that we wanted to disseminate, but we also thought that we had some challenges and gaps that we needed to identify and improve, and to be very transparent in that process. And then the second goal of that work was to address the equity in our research collaborations, and to specifically invest in our collaborative teams such that they could be equal partners in the research, and ultimately the leaders of those research endeavors. So that program had multiple levels. We felt strongly that we wanted to meet individuals to their interests and to their background. And so, as Wafai mentioned, actually one of my first teaching experiences was under Wafai in Tanzania. We do offer statistical trainings. Muhammad co-trains with us on a lot of those, is one of the statistical trainers that we use in those statistical trainings. But we also recognize that for some individuals, they may already have a good background in statistics and they need further opportunities to refine leadership skills or to go for their master's and PhDs. We also recognize for some colleagues, they may have no research exposure, and we need to offer opportunities to enter into the research field through introductions to research training series. And so we try to keep all of these training opportunities going so that individuals can enter at the level that they're interested. And if they want to progress through the training program and use that to build their research, either their research careers or research into their work. One of the fundamental cornerstone training projects that we have is this intermediate operational research course. We've now implemented this 4 times. It is an idea to paper training series. We invite colleagues from Partners in Health, the Ministry of Health, the University of Rwanda, to identify projects that align with their professional interests. For example, someone from the pediatric clinic might be interested why which children are most at risk of being lost to follow-up. They'll identify a question within their program, and then we take them through a year-long training series that helps them develop a research proposal. We then spend 6 months collecting data to the proposal, a week on data analysis. We spend some time refining those results, and then a week on paper writing. And to date, from these 3 trainings, the 3 earlier trainings, 20 of the papers have been published by the teams leading that work. And then we have another 8 papers from the series that just finished. We also, for me personally, have been using that training as a way to build out my research portfolio. So one of the things that we did in the intermediate operational research course is to have a specific focus on global surgery. And so we developed through the training 4 papers around surgery, and it was a win-win-win. One, we had collaborators who are now leading a lot of that work in Rwanda, including our lead study manager, who's now getting his PhD, came through that research training. 2, when we needed to apply for grants, we could say that we have traction in that area. So look, we have papers, we have preliminary evidence. And so we've been able to use that research training as a way to develop a body of work in global surgery. We've been able to link, as part of my role is to train Harvard students and postdocs. So we've been able to use it as a platform to bring postdocs and students to Rwanda. Sarah has been to Rwanda, actually several folks. There's been to Rwanda, Alicia led trainings there. So we've been able to host individuals in Rwanda, but are now requiring that colleagues are in country long enough to really add benefit to the project, to build these reciprocal partnerships. And then we just really spend a lot of time thoughtfully mapping out the research space. So actually my colleague Fred Kater is here, and we are locking ourselves in a room for 3 hours tomorrow, mapping out what are the papers we intend to write, who are the people that we intend to write them, and then coming up with mentorship plans for all the individuals that we think will be involved in that work. So I'm proud to say that we do, if you look at this index of publications, feel like this has had some benefit. Basically, the height of the bars represent the number of papers that have been published about Partners in Health Rwanda's work. The blue indicates papers that have been led by non-Rwandan first authors, typically postdocs or fellows, medical residents who go to Rwanda for work, and then will collect data and write papers. And then the red part of the bars are papers that are now being led by Rwandan first authors about the PhD space. And so We're happy that we are both documenting and disseminating our experience, but that this is a more collaborative space within Partners in Health Rwanda's work. So, do academic structures perpetuate bad behavior? This is something that we've been looking at for a while now. And just before I scare any students away, I want to say I have had, say this as if I'm about to retire, but I've had a very happy, successful, productive career, and I wouldn't trade anything for the world, but this is some of the feedback I've gotten along the way. Doing this type of work will ruin your chances for promotion. We cannot ask our junior faculty to do this type of work. We need you to be based in Boston to be available for our Harvard students. You can't spend so much time out of the country. And these are messages that I feel like, and I'm not alone, that if this is what we're perpetuating through our institutions, that it's going to shape the way we reciprocate. It's going to shape the way that we collaborate. And so we've been fundamentally trying to address this on an institutional level. We convened this symposium last year on specifically looking at how promotion processes in academia shape collaborative work. We have published those as a series of recommendations in the Lancet. Let me just give you a few examples. We believe collaborative work requires embedding. I actually have an administrative limit on the amount of time I can spend out of Boston. I'm not technically allowed to spend more than 6 weeks out of Boston. I had to take a leave of absence to be based in Rwanda for 3.5 years. And so one of the things we're suggesting is that we remove those administrative barriers and, if needed, extend tenure clocks. There's certainly a series of recommendations here. This has been picked up by the Consortium of Universities of Global Health, and we're in a process of refining these recommendations, and then that will be put out to the member institutions to try and address how promotion processes are affecting collaborative practice. So, where do students fit in all of this? You know, one of the things I thought a lot about is my training here as a student, and then also thinking about if we're trained under models where it's every woman for herself, how does that perpetuate in the behaviors of students who are future faculty? And I was just at a meeting where we were talking about C-sections, and the comment was, one of the reasons C-section rates are going up is because in places with high C-section rates, fellows are only trained to do C-section. They're not seeing enough vaginal birth to actually be trained well for complications, and so it's just a perpetuating process. And so I do think we as faculty have to think about when do we teach students to be good collaborators? Is that part of their PhD training? And so I reflected back on my PhD experience here, and I would say there were 3 things that really shaped that experience. One was the coursework, which now I don't even know that I could survive. But I was looking at this picture from one of our classes. I don't even know that I could tell you what this formula is at this point. But the coursework was really foundational to my ability to practice now. The second was, and as Wafai talked about, the mentorship that I received, the support that I got as a student in training, that Martel and I still have lunch almost weekly that I continue to receive from him. But a big part of my training here was taking a year off of my PhD and going to Malawi and spending that year working with the Centers for Disease Control and the Malawi Ministry of Health, helping to implement the first HIV drug resistance survey. And just what I learned in that year in terms of the realities of data, what I learned that year in terms of how to translate findings from a study to actual policy implications was just huge for me. And part of what my takeaway from this is that if I felt like in my experience I wasn't getting what I needed, to take ownership of that and find the opportunities to complement what I was getting through the school with better and other training options. So with that, I really want to commend 2 initiatives. I've been so impressed by the student initiatives at the school this year of really owning their graduate experience. I think all of the faculty here have been really just inspired by students saying, this is what we want, this is how we want to grow. So the global cohort, which you'll hear more about today, and then the Decolonizing Global Health to help us think about the syllabi that we offer in our global health program. I think it's really inspiring that students feel so strongly about how they want to be trained in shaping their experiences. So finally, I just want to end with a comment on this role of Reciprocal. I think, I highlight here 3 individuals who've been incredibly important in terms of my reciprocal collaborations. I think recognition that I have as much to learn, oftentimes more to learn than I do to teach, that everyone's success is intertwined. It is not a competition for first author papers. There are plenty of papers to write, and everyone's success is intertwined. That we need to be willing to give as well as to receive help. I think for some of us, we've been trained to be so strong and independent that to be vulnerable in our professional relationships is really important. And then, all of this to me is easy if you just have a fundamental deep care about the work and about the person. And so for me, reciprocal really comes down to spending time together, getting to know each other, finding out what each other's professional goals are, personal goals are, and finding ways that those align with each other's professional and personal interests. So I really, again, want to commend the students for the work that you've done to establish this cohort. I know it's a new initiative, and new initiatives are not always easy. And thank you for the opportunity to be here.
So thank you, Bethany, for the good presentation. So what we're going to do right now, we are going to just tell you about the Global Cohort Doctorate Students, which is a partnership to build capacity in house research. Myself, as they said, I'm Semaphore Mohammed from University of Rwanda, second year PhD student in data science, option-based statistics. I joined this global cohort recently, but my expectation was that I'm going to learn to share experience with other colleagues from Harvard. So having a peer is very important to me because there's someone that I'm sharing my work without any problem, and she could also give me the feedback before even sharing my work with anyone else, like my supervisor and so on. So we always discuss, we learn from each other, and we benefit mutually from the common goal that we set. So in this program, my peer is Sarah. Sarah is a PhD student here working on sampling related methods. I'm working also on spatial temporal models and predictions. So she has some interest on my work, and I have also some interest on her work. So we are benefiting mutually in that partnership. We're also interested to know about Rwanda-related data system and health and so on. And I'm also interested to know much about some of the courses that probably she knew that I don't have knowledge and so on. So we are sharing, we collaborate. So she can also say something about it.
Hi, so I'm Sarah Sauer. I'm a third-year doctoral student in the biostatistics department here at Harvard. I was interested in joining this group because I wanted to move beyond my quite theoretical training here and be part of a group that has a shared goal of doing impactful global health research while bringing a diversity of perspectives and backgrounds to the table. I work with Mohammed in this group, and I was particularly interested in working with him because I was interested in learning from him about his expertise in spatial statistics, and generally working together with another statistician who's really interested in the intersection of global health and statistics.
My name is Hari Iyer. I'm a fourth-year Epidoctoral student here at the school, and I joined this initiative because I was starting some work in Botswana and starting to shift into a completely new space in cancer. And I had some background in HIV, and I've always considered myself kind of a wannabe statistician. So when I moved there, I was very fortunate to meet Kesa Bolibatsi, who is a statistician and is doing some really interesting work on HIV incidence modeling. So we were able to form a partnership.
I am Kesa Mulebati. Hari is my partner. I am working on some methods of estimating HIV rate in course. I was interested in joining Global Cohort because I was benefiting a lot from Hari in terms of sharing some of the basic programming codes and also trying to learn how best to or how to explore some possibilities of applying my methods in other diseases like cancer.
The main mission of this global cohort is to promote shared capacity to address health problems by engaging research, contributing contractive forum feedback, and professional development activities. Sarash can also talk how we pair ourselves.
Yeah. And so as you've probably gathered already, the global cohort is made up of student pairs, where one member of the pair is from Harvard Chan and one member of the pair is a doctoral student at a partner institution. And so the process for forming these pairs really begins with identifying Harvard Chan faculty members who have established long-term collaborations with faculty members at other institutions around the world, who themselves are mentors for doctoral students. And so then the next step is identifying interested Harvard Chan students and doctoral students at the partner institutions who have common interests. And once those pairs are then formed, that paves the way for carrying out the global cohort activities, which Kesa will talk more about.
To achieve our goals, we first of all develop learning contracts as pairs, where we specify our deliverables, training goals, and we support one another, or how we are going to support one another. We, of course, write the learning contract with assistance from our faculty supervisors. We also recommend that each pair spends about 4 years each year working at the same research site. But of course, the work of the learning contract continues throughout the year. We also have a very, very important forum, the web forum through Canvas, where each member pre-records one of their work from the learning contract, and then they upload that recording along with some questions, and other group members have been able to give some constructive feedback on those kind of work.
Okay, so these activities have been trying to build from pair learning to expand to a community approach and some of with the web forum, as Kesa described. But the most important part is creating the sense of community, and for that we thought it was extremely important to bring people face to face. And so the final piece of this is having an annual conference. So this week we've been spending a lot of time getting to know one another, maybe. No, it's been really good, but it's been really wonderful that we've had the opportunity to bring everything together. So each of us have expertise in all these areas, and so it's been great to learn and have some discussions about that. It's been an opportunity to move our own research projects forward, get some insights from our faculty advisors, and then finally share some of this experience with all of you and have a discussion. So we're very grateful to you all for being a part of this. In terms of where we are today, I think I will probably just leave the picture and talk a little bit about the projects. Everybody's introduced themselves. So Sarah and Mohammed are doing some work on spatial statistics. Chris and Fentibo, who you'll meet very shortly, are doing some work on infections and malnutrition. And Simone and Samira, who will also be joining the panel shortly, are doing some work on nutrition and spatial analysis. And then Kesa and myself are doing some work around statistical methods and infections and And with that, what we're going to do now is we're going to shift a little bit. So we're going to invite a panel of students now to have sort of a public conversation and take some questions from the audience. So I'll invite Bethany to back up to be the moderator. And as the panelists come up, if you could introduce yourselves.
So I am conscious of time, and I want to make sure that we both give fair airtime to our students, but also to hear feedback from the audience. So I'm going to combine some of the questions, and then we can open it up a bit. So I'd love for each of you to introduce yourself, but in that introduction, can you talk about either your learning plan or your research project and one of your successes from this year?
Sure, I'll try my best to cover all those things. So my name is Simone Passarelli, and I'm a third-year PhD candidate in the Department of Nutrition, the Population Health Sciences PhD program. And Samira, right here, is my partner. My work is in Ethiopia, and Samira is from Ethiopia. And it was a really natural collaboration because she's working on all the same projects at Addis Continental Institute of Public Health. We were working on the same projects, on the same data already. And these are also my dissertation projects. So it was really fantastic to be able to find a partner where we could both benefit. We both have a lot of shared interests. I'll let Samira talk more about her research interests, but I was so excited to find somebody who's already working on this project with interest in nutrition as well. Oh, and a success, I suppose. Well, that's a success in and of itself. That I was able to find someone who but another success, I would think, is that our research interests really aligned very well. Samir is working on 2 different papers that I'm really interested in and that she was looking for some input on. And then I was really excited that she wants to work on 2 papers that I have one on spatial methods and one on qualitative methods. And Samira has much more background than I do in spatial methods and wanted to learn some qualitative methods as well. So I'm glad we could bring those things together.
I am Samira. I'm from Ethiopia, second year PhD student at University of Golden. So before we become a pair and joining the cohort, we know each other from working on the same project our institute shared. So we have been working in knowing each other, and we know that we have complementary skills. Each other can work together. So that once Simone becomes part of the global cohort, she invited me to be her peer, so that I happily said yes, and we start working together. So that I was interested to know and learn more about advanced statistical methods, both quantitative and qualitative. And she was also very much interested to know designing survey questionnaire using electronics method, and she also want to understand and learn more about Ethiopian public health issue and health policies, so that we complement each other. Once we identify this skill we both have, we sort them as our goal, and we develop our learning contract based on this, so that we we propose papers that can address this goal, so that we have now proposed 2 papers we are already working on. We put some timeline on that, and to make it more concrete and add some weight on, we already shared it to our supervisor and get approval, so that we are working on that. I think it's awesome.
My name is Chris Anderson. I'm a doctoral student in epidemiology. And I've been working with Doctoral now for a couple of years. I think one of the things that I have benefited from greatly in this engagement has been when we came together, we sat down, we had a conversation about what our goals were, what it is that we wanted to learn over the course of our doctoral years. And Father can share a little bit about what his goals were in a moment. One of my goals was to get engaged with primary data collection. And it was a great opportunity to work with Fontville because he does primary data collection, probably one of the most difficult places in the world to do so. He does tuberculosis research on migrant farmers, migrant cattle raisers in eastern Ethiopia. It's a very difficult context, and so we've had many conversations about sort of his research out there, and I was learning a lot about the actual conduct of that research. And then at one point, we saw an opportunity for a grant, and he said, "Well, I've had this idea for a while. Why don't you and I develop this grant together?" And so I was thrilled because here's this opportunity to be involved from the very kind of inception. So he had already thought quite a bit about this, but then invited me to kind of join in and share some feedback. We were very fortunate that grant got funded, and so we're excited that in a few months, I guess, we're going to start some data collection. So that's just been a great success, I would say, from my side.
Okay, almost this has taken some of my anyways my my name is Bethany from Ethiopia and PhD and at Arize University. So my PhD project is on tuberculosis, particularly the effect of delay in TB care on the infectiousness of patients in less privileged setting, that is the pastoralists in a remote area of Ethiopia. So from the beginning, Chris and I had an opportunity to be together for some time at Arize University when he came for a partnership and to deliver a course for postgraduate students, particularly on statistical analysis of longitudinal studies. So from that, I can identify my learning needs or learning aims. Like I came from university, very junior university established in 2007, where there are no senior guys that can teach you advanced research methods. So I know I had some gaps, particularly in statistics. So my learning aim or my learning need was to get something that comes from one of the world-renowned universities, that's from Harvard. So through that process, I learned a lot. For instance, I can say like my experience working with statistical softwares was basically restricted with spaces, but through working with Chris, I can develop skills working with stat and others. So that is a big success. In addition to that, the goal of this cohort is, in addition to reciprocal learning, it is what establishing a long-term or partnership that can last ever. So I can say Chris and me just where we get the tip of the track for that, because we have successfully won a competitive grant from WHO to conduct a research on tuberculosis.
So I'm hoping that there's students here who are interested in either joining the cohort or creating a similar type of partnership, even if it's outside of the cohort. And I can imagine this has not been seamless. I can imagine you've had some challenges with getting this off the ground or in your individual partnerships. So can you talk about maybe one challenge you have faced in this cohort, and any suggestions for people who are undertaking these types of partnerships, what they should keep in mind to address those types of challenges? And mix it up a bit. Can I start on the opposite end?
Thank you. Like, still we have progressed very well, especially in addressing our learning contract to pass through all the ways. And then now Chris and I, even though we are beyond the relationship between Chris and me, it's beyond of the technical issues, but we have been, good friends. Sometimes, we have, calls to talk about any other issue. rather than these technical issues. So that is the good thing. So the challenge.
Is Chris calling you all the time?
So that is, we are good in bilateral, partnerships, but now we are thinking about to bring all this community together, to achieve big things, because we are people from different countries, the African countries here, and then even the cohort is now growing because new members are coming in. So as Professor Ofai said earlier, just we are now the challenge. We don't come across, how to sustain this group and how can we establish, a very good network of all this community. Maybe this will have something that can help me.
No, I think I agree with that. Yeah. Would you like us all to respond to that question, or?
Yeah, I would.
Okay.
Either that or to affirm that this is as easy as it sounds.
And just to build off of what Bontebel was saying, that about our cohort growing, and as we get new members on, there are, of course, going to be growing pains. So we have to think about what we want our future to look like, and we've done a lot of thinking about this as we grow. So I think it's a really positive thing that there's so much interest. We have 9 students who are interested in joining our next cohort, and that's really, really exciting. So as is natural in PhD students, some of us will graduate, and we need to make sure that we keep that knowledge and that enthusiasm with the institution and with the students that we're passing it on to all the cohorts below us.
I think one of the unique aspects of this cohort is the physical contact, but then you're also leveraging technology to create a relationship. So can someone talk more about the web forum? What role does that play in developing relationships? Has it worked? Are there any problems with it?
I'd say that the web forum is a nice way to kind of maintain momentum, but it definitely doesn't get things moving in the first place. So, for example, Bontebel and I spent time together. We were working together. We get projects moving, and then I had the opportunity to present some work that we had done together on the web forum. Everybody gets together. They provide their feedback. I think one of the nice things about the forum is that because you can basically do a recorded webinar, people don't have to be all online at the same time, or if your connection is out or something like that, then people can still have this forum for engagement. So, I got feedback from people from, I think total 4 different countries, and then, however many disciplines altogether. A lot of feedback was like, oh, like, have you cut the data this way or thought about this aspect, things that I just would have never thought about. But yeah, I mean, it does sort of, like, even though it's a nice way of bringing those people together, it does lack the sort of life that being together. I mean, this just last 3 days that we've been together have just been phenomenal. And I mean, there's, not 10 years worth of web forums to get us to where we've been in like the last 3 days. So, yeah.
So we pow out a bit. I think we're going to just allow for more audience engagement now rather than doing the small groups. So I'd really like to open it up and hear from students who are thinking about doing this but have questions about it, faculty who have some insights about how students should engage in this cohort.
Hi, I have a quick question about, I guess it's kind of in that initial moment where you're creating the relationship and the contract, but in terms of data sharing between institutions, particularly when it might be public data through a ministry or the IRBs, there's a local in-country IRB, there might be a Harvard IRB, like it can get quite complicated. And so I was wondering kind of if that was an issue for any of you, and if it was, kind of how you navigated that, because it can create a lot of delays because, those barriers are in place sometimes for a good reason, but they can make those cross-country classes.
Thank you for your question. Fortunately, we didn't face this issue because I and Simon are working on a project data, our institute working together. So the project goes through both Harvard and SFH IRB so that we have a data sharing agreement so we can share the data easily. But of course, that's a possible question. Like well, now we are growing in different pairs join the group. This might be a problem so that we can consider it for the future. And we have to develop a data sharing agreement. But for now, for us, it's not a problem since we are working on the same project.
And one of the core tenets, like the reason it wasn't a problem is because we were building off of existing relationships between institutions. So Harvard has been working with ACIPH for I don't know how many years? Many years. So and within those collaborating institutions are faculty members and who have partnerships with other faculty members. So it's not like we're starting from scratch here. We have existing relationships or existing projects that we can build off of.
I was just wondering if anybody could speak on, well, everybody is very much invested in this project, but how did you compromise in terms of goals and in terms of the contracts that you developed? And then is there a process by which you decide that, okay, I've compromised on this goal, the next contract that we develop, could we insert this? And how does that dynamic work for the pairs?
Well, I'm sure Fonteville has had to give up quite a number of hours explaining things to me that are probably quite basic. So that's certainly one compromise. I see it as being, I think the main compromise that ends up happening is like the time that you invest. I wouldn't even call it compromise, but like you do have to invest time in your partner because they're giving you something too, and that's the piece of the reciprocity. And so I think because it's like I feel like I get to maybe Fonteville like I'm spending time to help Chris out, but maybe there's some way that Chris can benefit me. And I think that's certainly how I feel is that it doesn't bother me at all. I love spending that time together. And then in terms of like the specific research goals, because we've been able to pick, I think we've all picked partners who are pretty closely aligned in terms of research goals. That's all been pretty streamlined. So at least my experience has not been that we've ever had any kind of issue with, I would have rather done one project, but we didn't do that. Do you have any thoughts to add to that?
Just that's the role of partnership is just one thing is learning from each other or helping one the other, and then through working together, and then coming to common research ideas that can maintain. So if that's the goal. So we're always I wanted to know what Chris what the Chris learning aims, and then the whatever I can support to him. Plus that in the process, so he knows everything I'm working on, and I know on what Chris is working on because I'm learning from him as well as supporting him. So I never come across with like being fed up of yeah.
I would love to follow up on that question because I would imagine some things that might be proposed and on your learning contracts, when you get into the details, you realize they're just not tenable. They're overly ambitious or not really jointly aligned. So are there any goals, and I guess I'm expanding this out to the other teams, that you put in your learning contracts that you realize you've had to backtrack on? Do you revisit the learning contracts? And then moving forward, as this expands to 9 more teams, are you going to be prescriptive based on your experience of these are goals that work well, these are goals that don't work well?
Yeah, this happened to us when we plan when we developed the timetable for the first paper, we were very ambitious and we want to come up with the first manuscript as fast as possible, so that at the end we didn't achieve that timetable. So many reasons, others work-related activities, to other courses, and even the analysis took us more than we thought, so that we were forced to schedule that, and we learned our lesson that it's not too good to be that ambitious, but we take the lesson and we are rescheduling the timetable accordingly.
Maybe I think Chris and me started, or were the first to join this cohort. So we had just nearly almost a couple of years. And the other were fortunate because Chris had multiple travels to Ethiopia. So in Ethiopia, we have been, together for a long time. So that, created us an opportunity, to have plenty of time working together. So achieving our learning contract was not that much a challenge, but for the guys who are maybe not having enough time together working, sometimes it's important to be together physically, because you can be flexible in arranging your time. So Chris, when it comes to Ethiopia, has his own missions. I have also my own activities, but beyond that, sometimes work on extra hours, like in the evening, sometimes having lunch together and then discussing about our work issues. So I think in future it's better to think how the partners, come together in the middle of the partnership. Yeah.
I'd like to take your question, actually expand it a little bit, because you asked about, you have this partnership, are the problems with being too ambitious? I think I personally have a problem with just being too ambitious generally in life. One thing that has, I think, been a great lesson that I think all members of this have learned and gone through here is that setting reasonable goals and moving as a team together is much better than trying to rush and leaving people behind. And I'm also fortunate enough to be advised by Wafai. And whenever I go into his office, I ask him how he's doing, and he says pole pole, which is Swahili, which means slowly, slowly, but kind of more correct translation would be like slowly but surely. And things are getting done. And the other day, he told me another expression that I love, which is also Swahili, haraka, haraka, hukuna baraka, which literally means hurry, hurry, has no blessing. But more directly says, if you go too fast, you're going to get hurt. So I think that that's a great lesson that I have learned, and I think many of us have learned on this team, is that sort of we might feel really ambitious, but it's actually a good thing to kind of rein ourselves in and try to set the more kind of reasonable goals that can move everybody together forward, and that's where you're going to have your success.
So I saw a couple more questions. Why don't we take 3 questions all at once, and then we'll just open up to the panel. So yeah.
Okay. So first of all, thank you so much. I'm from, actually, the 3 of us are from the Tufts University Brigham School of Nutrition. And I think that we were really interested. Thank you to Hari for inviting us, and whatever else he's done to help create this program. My question, actually, I noticed on the flyer and just in the name, the first thing that stood out to me was that it was reciprocal capacity building, and I wonder why not capacity strengthening, I guess, because I know, it's maybe a very silly thing or it's one word, but language is really powerful. And for me, building gives a sense that you're starting from zero and that both sides are starting from zero. And I wonder, if there's a reason behind it, or if maybe there would be value in changing it to something like capacity strengthening to send a different message.
Let me take a few questions and then we'll make sure all are addressed. So there's 2 hands back. So very back, yeah.
I'm really excited to learn about partnerships like this. And I think that when you're working one-on-one, it's
it's easier to be on that sort of equal footing that you're aiming to be on. But at the crux of it, there are still the institutions behind these partnerships are very unequal at their core and at their foundation. And so I'm wondering how partnerships like this can maybe contribute to either a theory of change as to how those institutions can start to shift, or just other ways that this is reflected in kind of broader circumstances outside of the one-to-one relationship.
My question kind of builds on both of these and the earlier question. But I come from a CBPR background, community-based participatory research, and thinking about some of the language, again, on contracts, and maybe if you had thought about agreements or outlining the scope of work, or oftentimes we use memorandums of understanding to kind of bullet out responsibilities, and then thinking more about sustainability of this and how you're working within your own institutions. You've identified folks for the next cohort, but where are they in their training? And are they first-year students, or are they more senior-level students? And how does that kind of play out in the future?
So yeah, I'll let you add on, and then we'll open it up.
Okay, great. I was just wondering about any sort of implicit support that you all have had in the interpersonal dynamics that this all requires. I think mentorship and sort of reciprocal learning and teaching can be really challenging. And I was wondering whether there's been any kind of support, or whether that's just coming from your own kind of instincts and relationships. And I'm thinking about this specifically. I'm doing a PhD in the education school, sort of how we might be able to think about something similar, and whether there's been sort of these kind of explicit supports to help partners be effective, partnerships be effective, and what your thoughts are on that.
Great. So there was a lot there.
I'm happy to start with maybe I can lump together Ilana's question, and I can't see back there about about the language, questions about language. So yeah, I agree with you. The roots of the word capacity building, I am not comfortable with. But that also comes from a place where it's not reciprocal. And the distinction that we are really making is that it is reciprocal. It's not one-sided, and that's the whole point of the program. And I definitely agree. Maybe we should just not put the word building in there, because I don't always like that connotation. But I think a lot of people now are moving towards calling it capacity strengthening. So yeah, thank you for your comment. I think language is very important. And in terms of why we call it a contract, I mean, for me, I guess I never thought of that as a negative thing, because as a graduate student, I need accountability to get my work done. I think that's true of maybe all graduate students, I hope. So to me, I like the ideas like, this is a contract I'm signing, and these are activities I am agreeing to, and I'm holding myself accountable. Samira is holding herself accountable, and we're holding each other accountable to achieve those. But I'd be interested in looking at the CBPR, some of the language they use for that too.
Anybody want to comment on the question around how do these partnerships fit within bigger institutional dynamics?
Yeah, that means like it's become maintain the individual partnerships. At the end, we're sure they will grow to institutional partnership, because that means always if I'm working with a group or with my partner, that means I will represent my institution, and then we may have projects together. People from my institution are also I can't do we individuals can't do everything, but the people are engaging. So in such a sense, beyond this group, people working around us, including those people from Harvard, will be engaged. So that through time, hopefully, will grow to the institutional partnership.
The two, I think, related questions have not yet been answered are issues around sort of the ongoing supports that you've received in your partnerships. I caught that well, Celia. And then comments around like how is this going to be sustained for the future cohorts. Want to take that, Chris?
Since you started, you were one of the first people to start this program.
So, in terms of sustainability, I think it's the people and their sort of love of the mission that are going to move it forward, and I see that in all the people that are around me. Is that I know that the faculty and the students really truly care, and so I think that if there are people like that who are working on this, then it will continue. Money also helps. So there was actually the question about institutional inequity is something that we've had to struggle with a bit because I think there's a lot of financial resources for Harvard students to move abroad and to have certain experiences, and I can understand like why those funding opportunities exist. It was a lot harder to find financial opportunities for us to have our partners join us here and have the opportunity for them to benefit from some of the other resources that are around here. And so for that reason, we're very grateful for the Rose Fellowship, which has enabled that to be possible this year. So thinking about what that means in the long term is also something that's important. And then, do you want to comment on the interpersonal support, or I can if you don't want to?
Yeah, sure. So interpersonal support. Because most of these relationships, like I said before, are built on faculty, existing faculty to faculty and institution to institution relationships. One of the main, the core components of our student to student partnership is that we both have faculty advisor. So we have a mentor on each of our institution sides that is a mentor to us and who reviews our learning contract and works with us to make sure that everything is working as planned. So it has been really great. Like we met with Wafai today and he said, how's everything going? And how's your timeline? And gave us some good advice on one of our papers. So we do have some training there, which is really helpful. And I think someone asked about, to build on the sustainability, I think 7 of the 9 incoming students are first years, so we're really excited about that in terms of sustainability and enthusiasm in the early PhD years. And there was one more comment I don't think we've addressed about, was it about how can you do this in other models that aren't just student partnerships? Is that someone's question?
You should answer that question.
Yeah, I think it was about something like how can you build this into different kind of models. But that's why we were excited to have you guys all here to engage you in the conversation and think about how you can do this in whatever work this kind of reciprocal capacity strengthening, in whatever kind of work that you're doing in global health with your partnerships around the world. We hope that you can take some of the concepts that Bethany and Wafai were talking about if you're not a PhD student currently. So we hope that this work excites you as much as it excites us.
And that is the perfect end to the panel. So thank you very much to the panel. Sarah.
I think we are very mindful of the clock and kept you guys here, so I will be very brief. Thank you all for coming. I think we had a really good set of discussions from Mr. Fauzi talking about Arize, an institution that works at that level. Bethany had a really awesome presentation about helping us think a little bit more about how this matters at the faculty level and sort of set the stage for us. And thanks to our panel for telling us a little bit more about this program. We do hope that some of these ideas will be useful in your own work. We would be very, very excited to talk to others of you about this.
Basically said everything, but if you want to get in touch with us, this is our contact. Thank you very much for coming and engaging. Thank you.